I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. We've had some fascinating conversations about different models of healthcare, and I'm so pleased to welcome to our studio now Angela Mitchell. She is Manager, U.S. Healthcare Delivery Service Program at Intel. Great to see you.
Great to see you.
So as I did mention that we've been hearing a lot about how people are delivering care in different ways, and at Intel you're doing something very unique and really the only corporation to do this.
Right.
Describe the program that you have in place.
So we have a direct contracting relationship with healthcare systems instead of going through insurance, and it's called Connected Care. So knowing healthcare is local, we started in New Mexico. We have a factory base there, and Presbyterian Health Services is a pretty large healthcare system that provided a lot of care we already knew to our employees and families. So what we decided to do was go in, direct contract with them, and then put an accountability model in place. So we measure on anything from patient satisfaction with experience to access to care. And then obviously we manage our chronic disease patients so that we're making sure to keep a close eye on how the healthcare systems are performing. And in that dynamic, it creates that tension and awareness from a large employer that I think is really missing in the healthcare market, and the insight to really influence, right? So we can look and see on a monthly basis with this data that there's gaps maybe to this one clinic to get in quickly, or maybe they could be doing a much better job at outreaching to their diabetic population. Let's think creatively about new ways to do that. So now we're actually in Oregon working with Providence and Kaiser since 2015, Arizona working with Arizona Care Network since 2016, and then we just launched California in the Santa Clara and Folsom markets, working with Stanford and Santa Clara and Dignity and Hill Physicians in Folsom.
Okay, what does it take to really get this done? Are these physicians, providers dedicated to Intel only, or is just part of the communities that they serve?
Well, it's good to think of it as an ACO that's employer driven. So the providers themselves will tell them, here's all the standards of care delivery. Here are the requirements, essentially, of what we know is going to make a better healthcare experience. So we only pick healthcare systems that are really willing to be partners in this, that are willing to share risk in this. So there's an upside and a downside risk involved in the contract. And then that are also willing to really customize healthcare to be more patient-centered, and kind of de-layer and make it easier to access care. So what you'll find is these providers are providers in the community that were there before, but now because of this accountability dynamic with Intel, we're able to work with them and partner with them on making some significant improvements to the healthcare experience for our population. Now the nice part about this that we're finding is it really changes healthcare for the entire community being served, not just ours. And that's kind of the intention of Connected Care, is to go in, ask for what we know is going to make it better, and then have it actually impact and influence everyone who's being served.
Okay, so how does that work? So it doesn't just impact Intel employees, but others outside of that circle?
It's because the healthcare systems want to do a good job. You know, they want to do better.
So they've learned from their experience working with Intel?
So they're learning, and then they're looking at the metrics with us, and then they're thinking about creatively, how can I really improve quality more, make it a more patient-centered, better experience model, and then reduce cost over time by getting rid of waste in the system. So for example, you know, the things that we're asking for, I came from healthcare. So Intel hired me to come in and help to architect and design this and partner with the healthcare systems. So I had some insight, obviously, on the ground, knowing from a primary care, specialty care perspective, where opportunities already were to make improvements happen. Also from an innovation standpoint, where there were future roadmap items that maybe the healthcare systems were a little bit slower to implement. Now that there's a large employer at the table, they really do implement them much, much quicker in my experience that I saw in healthcare. So we try and make it a win-win situation. So it's a win for us. We know we're delivering better healthcare to our employees and families, and we can actually see the data that's showing improvements are happening. The healthcare systems have an employer to help incentivize and influence all these things that they've maybe been waiting to implement and change. And then at the end of the day, the patients and our members are getting a better healthcare outcome. And that just means a better workforce. It means, you know, a lot of great benefits. Yeah.
Lots of implications from that. Now, Angela, if someone were to hear what you were talking about, what are the beginning steps to maybe do this direct model?
Have a visionary leader that's willing to really take this up to the top from an HR benefits perspective, hire talent from the healthcare side, so bring someone in like they did with me, coming in to not necessarily be that, you know, health plan focus, but to really be the healthcare system focus, to get away from that insurance kind of brain into more of a, let's have 80% of healthcare be really responsible and on the shoulders of doctors versus insurance companies getting in the middle and making medical decisions, which we saw, you know, our data it's not uncommon for large employers to look at their data and see that a pretty small percentage of the population was driving our trend significantly. They were going into the ED frequent times, they were not being managed appropriately, but we as an employer had zero influence over changing their experience.
Right.
So by cutting out the insurance component and having it really be up to the doctors to make those decisions, which we feel is much more appropriate, it allows for quicker access without prior auths or referrals, and it's really a much more member-centric experience for them, getting the care they need when they need it.
Do you think this will send a wake-up call to insurance companies?
I think it already has, and this is just in our experience. We still work with large national plans because in our book of options for healthcare coverage, we still offer the Anthem and Cigna and Kaiser broader networks, but we really promote connected care. Because it is a narrow network, it can be hard for folks to choose it, so we promote it, telling them all of the guarantees to a better experience and the accountability on the healthcare system which our employees expect and already thought maybe was happening. But it's definitely driving business into connected care and away from those national plans. So I think it's definitely they're paying attention. And I think that more and more employers, as they jump on board and start doing this, they'll be paying a lot more attention.
Yes, I think you're absolutely right. And may I ask you, we're so pleased to have you here at the World Healthcare Congress, but why did you decide to present here?
I think that it's important for other large employers to see that it's working, because what we're doing, again, is unique. No one in the country is really doing it the way we do, and to understand what it took to build it and to share the best practices, you know, as a company, we feel it's important. Other large employers can jump on board and start to think differently about having more influence and control over the way that healthcare is being delivered to their employees. I mean, we are the ones paying the money at the end of the day for, you know, from a self-insured perspective. So I think it's just from a business perspective too, it's just the right thing to do.
Okay, Angela Mitchell, thank you so much for your time today.
Yeah,
really appreciate it.
Thank you.
And thank you for watching. Stay tuned, we have more interviews to come.